Hello everyone, today we are going to start the topic which is sacral vertebrae or sacrum. After many days I'm posting this video, so please pay attention to the topic. Sacrum bone, it is a joint bone of 5 types of vertebrae, which is S1 to S5. It is a fusion of these 5 vertebrae, and it is a flat triangular bone, as you can see here. See, it is not a flat, but still it looks like a flat triangular bone. There is a curve into it, that's why I said it's not a flat. It's a kind of a triangular bone, forms a part of posterior superior of pelvis. It forms a part which is posterior and superior part of pelvis. Now why this I'm saying is, like to here, from this side there's a hip bone joint, okay, this side. That's why it is saying it is a superior part and also posterior superior part of pelvis. Okay. At either side of it is joined by the sacroiliac joint to form a hip bone. Now as I said, both side, this is, see, here it is a joint. Okay. Now this side, on either sides of joint, here it forms a sacroiliac joint. Why sacroiliac joint? Because this is sacrum and the hip bone which has iliac bone, it joins here. That's why sacroiliac joint to form a hip bone. Now this joint helps in the transmission of weight. Now this is very interesting. When we pick up, like do any activity or do any work, that time during the weight transmission, this joint plays a major role, because through this only the weight is transmitted forward. Base is situated upward and is formed by S1 vertebrae. Now don't mistake here, the sacrum bone base is upward, okay, and it is formed by the sacrum vertebrae S1. Now bony resemblance of the L5 and it is connected with it together, they are forming the lumbosacral joint. Okay, now as I told you, it is a vertebral joint, so here it joins a lumbar vertebrae L5 and this is a sacrum S1, so it is called as lumbosacral joint. And its anterior margin of the body of S1 is very prominent and is also called as sacral promontorium. Now this is a very important term, sacral promontorium. See, S1 body is very prominent here, that's why it is called as sacral promontorium. Okay, now next is the anterior and posterior part of body. There are ligaments called anterior and posterior longitudinal ligaments. Now here many ligaments are attached, like anterior and posterior anterior and posterior longitudinal ligament, and other posterior there is a triangular vertebral foramen. Okay, here anteriorly and posteriorly. Okay, this is the spinous process, kind of, I will tell you. Here it is anterior and posterior longitudinal ligaments which are present. Now posterior to the body is a triangular vertebral foramen called as sacral canal. Okay, here I will tell you, wait, see, this sacral canal, what it is called in the cervical, thoracic and lumbar vertebrae? Vertebral foramina. But here it is called, it is a vertebral foramen, but still it is called as sacral foramen. Is it visible here? Now see, this is a triangular shape on posterior side. This is the posterior side. It is called as sacral foramen, sacral canal. The direction of the vertebral foramen is upward and slightly backward in case of anatomical position, and the body of S1 should make a 30-degree angle. Now this somewhere it is anatomically, you should understand. Okay, see, now if I am holding this bone in such a direction, in such a way, Okay, see. Now this is the position of that bone. Now if I draw a lumbar vertebrae curve, I'm saying curve, I'm not drawing the lumbar vertebrae, I'm saying lumbar vertebrae curve. Okay, see, here it comes like this. Okay, now the direction of vertebral foramen is upward and slightly backward. Now this vertebral foramen, which I said sacral, is upward and backward, slightly backward in case of anatomical position, and it should make, now see this, vertebral foramen would come like this. Okay, and this sacrum, it is making a 30-degree angle with it. Now content of sacral canal are quadra equina, phylum terminale, spinal dura and spinal arachnoide. Now in this sacral canal, as you know, if you don't know, I'm telling it, just a minute. Now if you don't know, I'm telling this, if you know it, it's good. In this sacral canal, there is a content like vertebral foramen, it carries a spinal cord, it is a protection, vertebral foramen is a protection surrounding to the spinal cord. Now spinal cord, it ends near L1 or L2, at the border of L1 and L2. So below that, what is the continuation? It is quadra equina, phylum terminale, phylum terminale, spinal dura and spinal arachnoid. Postolaterally, there are pedicle which are short, thick and directed laterally. Now, postolaterally, okay, these are the pedicles. This. Postolaterally, there are pedicles which are short and thick and directed laterally. The lamina will provide attachment to the lower part of ligamentum flava. Now, in cervical vertebrae, thoracic and lumbar, we studied lamina extends backward and it forms a spine. But here, it also extends backward. Here is a small spinous process and it gives attachment. This is called the lamina, and this attachment gives to the lower part of ligamentum flava. Here posterior part, it's attached to the ligamentum flava. Okay. On either side of the body, there is a triangular expanded bony masses which are formed by the fusion of costal element with the transverse element. Now, see, on either side of the body, this is the posterior side, we have to see the anterior side of it. Now on the anterior, on either side of the body, there is a triangular expanded bony mass which are formed by the fusion of costal element with the transverse element. Now see, this is called ella of sacrum. It is called as ella of sacrum. What I said is, see, in the vertebral of thoracic and lumbar, there were kind of a costal elements, transverse elements, but here it is not. Here it is formed as a ella of sacrum. This ella is smooth. Ella is smooth. Okay. Medially and rough in the lateral part. The anterior portion of rough area forms joint with iliacus and the posterior part gives attachment to the lumbosacral ligament. Okay, now as I said, this ella, here it forms a joint with what? Sacroiliac joint, and here lumbosacral joint. So it gives attachment to the ligaments of this joint. Okay, here it is sacroiliac sacroiliac ligament and lumbosacral ligament. The anterior portion of rough area forms joint with iliacus and the posterior part gives attachment to the lumbosacral ligament. The lateral margin of ala provides attachment to the ventral sacroiliac ligament. The lateral margin of ala gives attachment to the ventral sacroiliac ligament. Here it is the sacroiliac joint. This area gives a attachment to the ligaments of the sacroiliac ligament. On anterior part there are 4 horizontal ridges. Now this is also important. See, 1, 2, 3 and 4. These are 4 ridges, horizontal ridges of fusion of sacral vertebrae. This is a S1, S2, S3, S4 and S5. This is the fusion of sacral vertebrae. On either side of there are 4 pairs of foramina called as pelvic sacral foramen. This is pelvic sacral foramen. And what it is called as transverse ridges. These lines are called as transverse ridges. Okay. Now the midline of the posterior region, the upper part is related to the peritoneum, whereas lower half is related to the rectum. Okay, this is kind of it's not important here now, so I'm skipping this part. Okay. Now on the posterior side there is a small notch called a sacral hiatus. Posterior side. Okay, here see this, it is called as sacral hiatus. The sacral and coccygeal nerves and phylum terminale comes out of it. Now sacral and coccygeal nerve. Now here coccyx bone is attached. Okay, it is not finished. It is coccyx bone is attached. That's why sacral and coccygeal nerves and phylum terminale comes out of this. There is an intermediate sacral crest situated in line with the superior articular process, and lowermost part of the crest is also called as sacral cornuum. Okay, I will tell you, wait. Now on the lateral surface on upper part there is an inverted L shape called as auricular surface. On the lateral upper part on the posterior side there is inverted L shape called as auricular surface, and with the articulation with the hip bone it is called as sacroiliac joint, as I told you already. And near to this crest, like see, near to this crest there is a foramen. Okay, these are called as sacral foramina, posterior sacral foramina. Behind this auricular surface there is a rough pitted area called sacral tuberosity. Sacral tuberosity I will tell you, wait. Now see, here it is a rough pitted areas. Okay, these are called as sacral tuberosity. Sacral tuberosity, and this provides attachment to the interosseous sacroiliac ligament. This provides attachment to interosseous sacroiliac ligament. Okay, now below the surface there is a region in which there are connections called gluteus maximus, sacrotuberous ligament, sacrospinous ligament and coccygeus muscle. On the lateral surface, more below, there is abrupt surface. This provides attachment to the lateral sacrococcygeal ligament. Okay. Now as I told you, here is a coccyx bone joint. Okay. Now as it is joint, it is also connected with the ligament. That's why it is called as lateral sacrococcygeal ligament. Now tell me, how many joints are there? There are 3. One is sacroiliac joint, lumbosacral joint and sacrococcygeal joint. Now according to this, there are ligaments which are attached. There are what are the structures on posterior side? As I told you, once again we would revise. This is superior articular facet. Okay, this is sacral tuberosity, This is lateral sacral crest, sacral tuberosity, lateral sacral crest. This is median sacral crest. Oh. This is median sacral crest. This is intermediate sacral crest. Wait, it's not visible here properly, but it is there. This is intermediate. Okay, this is intermediate sacral crest. Oh, sorry. This is intermediate sacral crest. Okay, this is sacral hiatus. What it is? Sacral hiatus. This sacral hiatus. Now here near the sacral hiatus there is a sacral horn. Okay, now this is the posterior sacral foramina, as I already told. Posterior sacral foramina. Okay. Now next on the anterior side, once we would go through it, what are the structures we have studied. This is sacrum promontory, sacral promontory. Okay, this is superior articular facet, as I already told. This is ala of sacrum, ala of sacrum. This is sacral part of linea terminalis. This, okay, sacral part of linea terminalis. This is anterior sacral foramina. Okay, anterior sacral foramina. This is transverse ridges. 1, 2, 3, 4. Transverse ridges. Okay. This is apex of sacrum. Don't forget, apex of sacrum is down and base of sacrum is up. This is apex of sacrum. And this is base of sacrum. Till here it is clear. This was the anatomy of sacrum bone. These are the structures. These were the transverse ridges, base, where is the apex, which are the foramina. And one more thing. This is sacral foramen, sacral canal, triangular shape. Sacral canal. Okay, till here it was about the sacrum. Now in next video I would continue of the coccyx, which is a small bone, which is it doesn't have any kind of huge thing, but it is important, so we need to study. And till here I have completed the vertebra. Only one part is left, coccyx. Then we would move towards the another bones, and like this we would complete each and every topic. So thanks for watching. Please study. Open your drawing book, which you can see the pictures, which you can relate, which you can memorize. Okay, this is important because later you won't like understand where the ligament is attached, where the muscle is attached. That's why you need to know the markings of which part is called what. So it is important. Anatomy is just about imagination and keeping in the mind that which part called is what. Okay, so thank you.